I am Nicole Fox. I am the Associate System Medical Director for Behavioral Health for St. Luke's. I am a psychiatrist. So that means I'm a medical doctor and my residency training is in psychiatry. I am also a board certified lifestyle medicine physician. So that I can then integrate into my practice. My practice is based primarily in the hospital setting in the main medical hospitals. And so what that means is that I actually see patients who come into the main medical hospital typically for some sort of an illness or a condition. And maybe they have psychiatric conditions or they have medications causing psychiatric symptoms, even if they don't have a psychiatric illness, or sometimes it's a confusing clinical picture. Uh, the main admitting hospitalist is not sure if the situation is psychiatric or neurologic or medical mimic of
Mhm.
psychiatric illness. So those are the patients I see. So when it comes to suicide, so there are a
Mhm.
lot of things to think about. So there's something called a screening tool,
Mhm.
and then there's an assessment. And those, it's really important to understand those are different things. So something that is screening does captures more people than probably actually are suicidal because you don't want to miss anything. That's called
Yeah.
being more sensitive. So at St. Luke's, we use something called the Columbia as a screener. It's a suicide risk screening tool. It's got certain questions on it, and depending on how people answer, they either screen positive or don't. Then, if someone has a screen positive, that means they would need an assessment to see if they really are high risk for suicide. Something like the Columbia and screening tools are created so that nurses and social workers, and to some extent psychiatrists, but not as much, can
Mhm.
more readily screen for concern of being at risk to oneself. In order to be a psychiatrist, you've done 4 years of residency after medical school. So by the time you're practicing, you have about 20,000 hours of direct patient care and management. And part of those hours is learning how to screen for and assess for all the mental illnesses
Mhm.
and for suicidal ideation. Lots of folks have suicidal ideation meaning that they have a thought of suicide. And some people have thoughts of suicide or killing themselves, popping into their head,
Mhm.
often, but it doesn't mean that they actually want to kill themselves.
Mhm.
So part of the screening is differentiating between what would be called an intrusive thought. Someone's got a
Mhm.
thought popping in their head over and over. That could be more of a sign of OCD,
Mhm.
that intrusive thought, versus someone who really is suicidal and um, wants to end their life. Typically, when someone wants to end their life, it's because they feel trapped. They don't see any other solution or any way out. We call someone imminently suicidal. So you've probably heard of a mental health hold. So someone can be put on a mental health hold if they're considered imminently suicidal. And that means that there is a very high concern that that patient or that person will attempt suicide within 48 to 72 hours. That's different than chronic suicide risk. So,
Okay.
some people have an elevated chronic suicide risk over the rest of the population, and that is because they have some underlying situation, maybe childhood trauma, or maybe they have, some substance use disorder
Mhm.
or depression or bipolar disorder. They may be chronically suicidal, have chronic thoughts, but that doesn't mean that they're going to attempt to suicide at any certain
Mhm.
day. It means that they're already at a little bit elevated risk. And then if something happens where they feel trapped, like there's no way out, they may become acutely at risk. And so the role of the mental health system then becomes, and in the case of me with a specific patient, would be to help them find a trap door. If someone is feeling stuck in a relationship, or they're feeling stuck in their home situation, or they're feeling stuck with, they've had let's say someone's parents really want them to be a doctor or lawyer, and they want to be an artist, and they feel like that feels very overwhelming. They feel very trapped, and that might lead them to feel suicidal. So the job of the psychiatrist is to, one, understand if there's depression underlying it or
Mhm.
another mental health condition that could be treated so that the patient or person doesn't feel their feelings more strongly than they otherwise would. Because sometimes
Mhm.
what's happening is you've got someone who just doesn't have the coping skills or the toolkit they need, and they're feeling their feelings very intensely. And so, if there's something we can do to help kind of soften that, we want people to feel their feelings normally.
Yeah.
But when you're depressed, you might feel things more profoundly
Yes.
than someone who doesn't have depression. And so, if someone's feeling very strongly, and we can soften that a little bit, maybe they wouldn't feel as trapped. And then help the person figure out what the trap door is. Is there a way to help facilitate a conversation or help them feel empowered to have a conversation with their parents about their authentic desires and beliefs for their life? Best way to show support is to validate. Now, if I'm taking off my psychiatrist hat, and if you were to come to me and say, "Hey, I'm, a regular person, I'm not in mental health. How do I support my friend who's suicidal?" I would say the first thing you need to do and can do is validate that they're having a really hard time. Please don't say things like, um, you wouldn't be given things you can't handle, or you're stronger than that. Just chin up, you'll pull through it. That's not helpful to people who are having suicidal thoughts and who are feeling already invalidated by the world they're in. No, what they need for you to do as a friend, as a teacher, as a neighbor is to say, "Wow, I had no idea you're going through that. That sounds really hard." And not expect them to say anything. If they don't want to talk to you, that's okay. You can say, "I know you may not want to talk right now. It's okay. I'm just going to sit with you."
Just being there for that person is really, really important. And
Exactly.
the
Mm.
more we listen and the more we learn, the better collective we are going to be as a community.
But more often, what we see is that, especially in young people, and I think Idaho has the fifth highest suicide rate in the nation right now.
Mhm.
In young people, what we will see is more impulsive suicide attempts. So something's gone wrong in a relationship or a friendship or something like that, and they act impulsively. In those moments, the important thing is to keep some distance. Help the person keep some distance
Mhm.
between their thought and the action they might take. If you know someone who's suicidal and they have guns in the home, the absolute best thing you can do is help them get those guns out of the home. If you can just get 10 minutes between the thought and the action, that most folks will not attempt suicide. If you make it really easy for someone to get a gun out of the gun closet, that happens way quicker than 10 minutes. But
Mhm.
if it's in the next town over at, your cousin's house, that's a whole big trip and an effort. Truly, the best thing we can do to prevent suicide by firearm is to make sure there are not weapons in the home.